Welcome to Life Her Podcast, the podcast that guides you from the 9-to-5 grind to the freedom of your own path. Discover how to conquer life's challenges while pursuing your passions with unwavering faith. Because being an entrepreneur is not easy. So let's get to it.
Hey everyone, I'm Yvette Lloyd, host of Life Her Podcast. We are joined by Chardé Hollins, President and CEO of Relevance Connection in Cleveland-based organization transforming access to mental health services across Ohio. With over 15 years of experience in healthcare, education, and social work, Chardé has helped secure over $10 million in funding for nonprofits and led groundbreaking efforts to place mental health services in every school in Cuyahoga County. She's a passionate advocate for equity and self-care and systemic of change. And today she's here to share her powerful insight on mental wellness and gender awareness in healthcare and how we can all take things and better care of ourselves in our communities because we all know it's needed. So, hey girl, hi Shay.
Hey, thank you so much for having me.
Thank you. I really appreciate you and what you do. I was looking at so many amazing things that you do. And one thing I want to know on a personal level, how is your mental health?
Ooh, girl, how much time do we have? No. And I say that because it is important for people to know that mental health is a lifelong journey, just like physical health. So
Yes.
in the moment, I feel great. I feel good. I know for me, mental health is about recognizing when you need support and utilizing it. And because I am at that space in my life where I am not ashamed for reaching out for help, therapy, or whatever the case may be, I say my mental health is doing pretty good.
That is amazing because sometimes when people are doing things in mental health, far as what I read, and I could tell by you and your personality, you wear your heart on your sleeve.
Yeah.
So sometimes a lot of things what you do in the communities and see and experience things, and you take it to heart, maybe,
Yes.
and so I just love to see that people are still working on themselves while they're helping others because Lord knows we need it.
Yes, I tell people many times, whatever profession you are doing, especially within a helping profession, you're doing it because of a lived experience that most likely was tied to trauma. So when you think about someone who is in the mental health field, or even a doctor, nurse, or whatever the case is, a teacher, an educator, it's because something happened in their life and they want it to be the helping profession. And whatever happened in your life, while you're feeding into others, you have to restore yourself as well so that you can be healthy for those that you want to help.
Yes, you ain't lying about that. So you worked across healthcare and corrections, education, grant management. How did all of this led you to founding your Relevance Connections?
Well, we were founded to be a creative, innovative mental health solutions to address systemic challenges. So we provide consulting, training, program development, whether it's schools, nonprofits, or businesses. And we really want to make sure that people have the tools and the concepts they need to implement sustainable mental health initiatives. So many times it happens and then it's gone. It's a good training, it was a good talk, a good conversation, and then it's over. So our goal has always been to ensure that mental wellness is prioritized in all spaces, that it's more than an initiative, it's a lifestyle. So, and the way we do that is by making it accessible and relatable to everyone, whatever that looks like.
Wow. So, many people think that self-care is like bubble baths, spa days, but your work suggests it in a deeper form than that. How do you define the real self-care?
Self-care is free. It costs nothing but time and possibly a few tears. And I say that because when we are thinking about self-care, when I tell people is you want to be able to identify things that you are doing on a daily basis that doesn't take away from the productivity of your day, but it enhances productivity. That because I do this, I am more productive. When we are, and we don't always have money for nails, hair, and massages. If anything, that makes me more stressed because now I have to think about bills. So when we're thinking about what are some practical tips and strategies that we can utilize for mental health and for self-care, one is take time to write down how people can support you before your crisis happens.
Mm. And that's a lot too for some people for them to actually manage that, because like, how do you feel with people actually facing their fears and facing their reality when it comes to self-care and mental awareness? Because sometimes people are afraid to actually face those things for them to be able to move forward.
Yeah, and that's why when it said self-care is about, it's free, but it may take some tears, because you have to understand that there's going to be a moment where you have to sit in silence and ask yourself, what do I need to live? And not just beyond money, beyond housing, beyond partnership, beyond a job. What do I need to live? And many times it's community, but it's this very specific type of community, and asking yourself, what does that support system look like? Many times it's identifying who our support system is, but taking the time to write down how they can support us before it happens. Because if anyone's like me, when I'm in the middle of something and I'm frustrated, that is not a good time to ask me, how can you help? How can I help? I don't know. If I knew, well, I wouldn't be here. And so, however, if we took time, whether it's something big or small, but if we took time to just write down different things that say, what your favorite candy is, what your favorite song is, something that makes you feel happy. And this is from children all the way to your spouse, your partner, your friend. Because my daughter knows what makes mommy happy when I'm feeling down, all of a sudden she does those things naturally because she recognizes it. And it has nothing to do with money. It has everything to do with giving mommy a hug, giving mommy 5 minutes to process. She recognizes those things, and that's a part of my self-care, is communicating with my support system what I need to live. And that's not money, that is time. And it took tears too, because I had to sit down and think, how can I communicate this with a 5-year-old? But she's doing a great job.
I bet. The communication with a child, especially at an early age like that, it helps them later on in the long run. And when you create some form of like routine and explaining it to them, because a lot of times young kids, they do things off what they see and hear a lot of times. So if you're not correcting them and getting at their eye level to explain to them why and how and different things like that, they will literally never know. So I applaud you for that.
Yes. And then we have different things. So I have something called a self-care plan. And the self-care plan allows for you to answer some questions about yourself, and you can share it with the different people in your life. So whether it's your coworkers, whether it's your spouse or partner, whether it's your family, or even if it's a child. But these are the things that if I'm feeling this way, this is what could help. Or if you see these signs and symptoms that I'm doing, that means this. And so it's just a good thing to sit down and complete. So that way, all of these people, your work best friend knows how to support you at work, your child knows how to support you at home, and so forth. So definitely encourage people to create their own self-care plan before they find themselves drowning.
Wow. So what are some practical and realistic self-care habits that men and women can start implementing even in the midst of the hectic schedule?
So silence, right? Or doing something that you enjoy in that car time. everybody is spending some type of time, whether it's the car, the bus, some kind of vehicle. I tell people, if you want, putting on headphones and using that commute to listen to what makes you feel better. Okay. For me, when I don't have kids in the car, silence, sometimes it's music. So I say utilize your natural commute time to do something you enjoy in that moment. Okay. The other thing is setting boundaries. And these boundaries can be within things that you already have to do. Okay. So once again, I'm all about practicality. As a mother of two and a wife, I make dinner. Okay. And yes, that can be a stressful time for me, but the boundary is the kids cannot come in the kitchen. And it creates that boundary, even though it's something that I have to do, gives me some form of self-care because it lessens the stress in the moment, right? And so identifying different things that you do have to do, but setting boundaries around them so that it's an easier load for you.
Yeah.
Okay. Because I think sometimes when we're thinking about self-care, it's all about things that we're going out of the way for. And the biggest thing is we don't have time to do extra things if we're just real. So I always tell people, let me know what your day looks like. And in that day, we're going to find times to just naturally say, I'm choosing me in a positive way. So that way I can be supportive to others. Your commute is natural. The responsibility of dinner is natural, right? The responsibility of bedtime is natural if you have children. So that boundary of, I'm going to make sure that the children are in bed by a certain time. And I say this as a parent who that's hard. But what it does for me is it makes me realize that if I stick to bedtime routine, it is a self-care for me because then I have more time for me. And so I flip how I think about a routine that's usually stressful, so and implement it in a way that can empower me to have more self-care. Because the longer I take to put the kids to bed, the longer everybody's going to be awake, and then I don't have time to binge watch something. Yeah. So when we talk about practicality, to tighten it up, it's one, always utilize your organic schedule to implement time for yourself. So that's your commute. That's a responsibility that you have at home. And it's also by setting boundaries.
Okay. What's so crazy is when you was talking about not coming in the kitchen, my mom used to shut the kitchen down at 8 o'clock. And I guess that was her moment of being in the kitchen, or like cooking and preparing and doing different things. But I never thought about it. So you literally just said that.
Yes. So many things make sense now.
Yes, it does. And it's just the fact of just having boundaries overall and just putting yourself first. Because I don't think, not until I got in my 30s, girl, I started sitting in the car for hours. I took a nap in the car. I will just be just sitting there instead of just getting up and just going in the house. So
Yes.
it's like the car, it literally hits different.
It does.
It really do. It's like you just in your own little cave, your own little bubble, and just gathering up your own thoughts.
And that do not disturb on phone after a certain time. Have do not disturb on your phone, whether you want to turn it on at 9 p.m. or whatever the case is, but having a certain time. The people who, if there's an emergency, people can get in contact with you. But just keeping that in mind that, okay, I'm going to put do not disturb on my phone at a certain time. So that way, once again, I can shut out the noise from the outside.
Mm-hmm. So you've helped bring mental health services to every school in Cuyahoga County. Why is it important to center the equity of, like, when it's addressing as far as mental health?
Yeah. So it was every underneath Governor DeWine, there was an initiative to make sure that there was mental health prevention and education and access to all districts within Ohio. And in a role, I was able to do that within Cuyahoga County to make sure that each school district was able to receive support in mental health through different community partners. And so this is just really important to make sure that the systemic barriers that exist, such as economic disparities, lack of insurance, cultural stigma, it often prevents marginalized communities from accessing quality mental health care. This barrier, it just reinforces the cycle of trauma and prevents individuals from receiving support that they need and the stigma attached to receiving support. So it's just really important to make sure that it's accessible and it's in places where people go all the time, which schools, of course, is one of them.
Yes, definitely. So with you being in this field for so many years, I've known you seen a lot. So with you seeing a lot over the years, what changes have you seen in the generations as far as children, and what are some of the things that parents or teachers or leaders can do better to understand our today's children a lot better?
So with each generation, things have shifted. And so what I will say about the generation today is that they're more aware about mental health. They speak about it more. However, sometimes it can come across as more of a social conversation rather than a meaningful one. And so it's important that although we are very happy that mental health is the talk of the town, we also want to make sure that it's not just something that is being talked about, but also implemented, that we are actually, as their caregivers, making sure that we're signing them up for the resources, that it's not just something that's on TikTok in a post, but we're taking that extra step to say, hey, let's sign you up for therapy. Let's sign you up for an actual group that, is about how to cope, how to communicate, how to process. And I tell caregivers that our responsibility is to make sure that just as natural as our children know what a doctor is, a dentist, and an optometrist, that they also know a therapist. All of those things that we talk about are health professions, and a therapist is also a health profession. And so as caregivers, our responsibility is to make sure that we are taking them to all health professionals, including a therapist.
Yes, and that is like so important. So what are some systematic barriers that prevent marginalizing communities, especially women of color, for accessing quality mental health care?
So definitely stigma has been attached to some of it. And what I will say now, it's really the idea of the lack of representation. And so there was definitely a time where there was a lot of stigma within the Black and Brown community when it comes to receiving help. We have done a very good job of minimizing and decreasing that stigma, where now people are more aware about mental health and are more willing to receive help. However, when we go to receive help, the representation isn't always there, which causes us to pause and say, never mind, never mind. So having representation is very important, and making sure that we're able to find someone who can support us. Women are twice as likely to experience major depression, yet they are also more likely to have their symptoms dismissed or misdiagnosed, especially with women of color, where we are facing racial bias in healthcare, and we have the mentality of being the strong Black woman. And we don't tie strong Black woman into receiving help. But it takes a lot of strength to ask and to receive help. So that mentality of being a strong woman, man, boy, or girl is tied to asking and receiving help, because that takes strength.
Tell me about it. And it's so difficult even for women of color, because they do look at us as strong black women, or our like approach is strong and different things like that, but we wear so many hats, and it's like sometimes we just need a break.
Yes.
Like, can we get a break, or can we have people cater to us and pay attention to us, hear us out, and it's just like we just go through so many difficulties when it comes to us being women of color. Is
Yeah.
it's so overrated to a
Yeah.
point where I'm over it.
Yes. Yes. I mean, and there's so many gender biases, and you have to think about just research in general. So all of these
Yes,
diagnoses, all of the medication oftentimes are based off of a male being the person who they were researching or did this
yes,
things on. And so we have to think about, we need to make sure that there's more research that focuses specifically on gender-based mental health needs, and that there's training for healthcare professionals to recognize and address the disparities. So that way, when you are talking about, what you're going through, that you're less likely to be misdiagnosed or dismissed, because there have been studies and research that were specifically for this demographic.
yes. And I have a daycare center. So what I have noticed, even with some of my parents, infant mortality is just so high. Black women are I've had one parent like pass from having a
Mm,
child,
I
or
see.
just babies not making it past 1 years old, and just having difficulties with doctors. I done seen mothers taking their kids to the hospital to get immunizations, because we need immunizations, and I've seen the child shift from normal to autistic, you know?
Mm,
So it's so many things that come with it in the healthcare system, and it causes a lot of mental health issues with the parents. And I've
mm,
seen the women, I've seen them break down by the day. And
yeah.
them getting the proper service and help after experiencing so many traumas when it comes to their children, because a lot of times, in a sad reality, I haven't seen too many fathers lasting in a relationship with the mother,
Mm,
not even past the child being 1 years old. So
yeah.
it's just so many mental health barriers when it comes to that, especially when you're seeing it in the front lines of being in childcare, in the beginning stages of them becoming a parent, or them
Yeah.
being a parent with multiple children. And it's really tough. It's really sad to actually witness a lot, especially when you try to help them and advocate for them in many ways.
Absolutely. Talking about infant mortality and women in health, I have to shout out Village of Healing. They are a great health center that is specifically for Black mothers, those who, whether you're going through and currently pregnant, all the way through the life cycle. And so I encourage people, because representation matters, and I love going to see them, because when individuals, see therapists or mental health professionals who understand their cultural background, they are more likely to feel seen, heard, and validated. And the symptoms
Mhm.
that you're talking about and the experiences that you are feeling aligned with the person who's right in front of you, who can, prescribe medication, who can perform tests and be able to explain things to you in a way that is culturally competent, because it helps build a bridge of trust, because the
Right.
gaps, and for whatever gaps they are, so that we can improve outcomes, and we can literally save lives.
Yeah, I think sometimes it's not really the lack of resources, it's just the lack of acknowledgement. A lot of people really don't know where to go, who to reach out to. And then you got them having trust issues, but they not even giving those individuals a chance to actually help them for them to get better. What is some advice do you have for advocates or parents or just women, men, on basically them actually having the resources but actually utilizing it to go through things so they can get through their situation?
The best way I can explain it is seeking help is like dating. You're
That's
not going to always get it right the first time, but you don't quit. And sometimes we do quit, but then we like, man, I do want some companionship, right? And so we have to think about the first person you go to may not be the right one, but you have to continue to keep on trying. There are resources of different questions that you can ask. We provide a sheet of things that, hey, this is what I should look for. These are questions I should ask when I'm interviewing a therapist, right? And once you find those things, then you can figure out if it's the right person. I also say at least go to 2 or 3 sessions before you quit. The first one's just going to be an informational session. They're just going to be asking you questions. The second one can feel a little bit awkward, but by that third one, you should have some type of rapport where you feel better. Okay.
yeah.
So at least 3 sessions, come, like I said, Relevant Connections, we provide like a list of questions that you could ask or things that you can ask yourself of what you're looking for. So that way, when you're searching, just like in dating, you know what you're looking for. You're not just going out there saying, oh, this is a therapist, I'll go see them. And then you're not fulfilled. So have those expectations, know what they are, and give it a shot, at least 3 tries. And if it doesn't work, go to find another one.
Yeah, you gotta keep going to better yourself.
Yes. And oftentimes those therapists can give recommendations. So it's okay to say, hey, I thank you for the time you spent with me. Do you have someone that you could recommend to me now that we've spent some time together? Because they want you to enjoy yourself too. It's not like breaking up. So there's no hard feelings. There's no hard feelings with the therapist if you decide that you no longer want to work with them in that capacity. Utilize your communication skills and it's okay. Move on.
Yes. So, what are a few actionable steps organizations can take to provide more equitable mental wellness support?
Yes. So organizations, they definitely want to integrate mental health and wellness into their culture by offering trainings, implementing inclusive policies, ensuring that there's accessibility to mental health services for employees, regardless of their background. One of the biggest things that I share with HR for organizations is making sure that people are aware of their benefits and utilizing them. Having policies that encourage people to seek out mental health. If someone walks into the office and they have a bone sticking out of their arm, you are not going to let them stay at work. Not only that, you're going to say, please, before you come back to work, make sure there's a doctor's note that lets us know how we can support you while your arm heals. We should do the same for mental health. When someone is going through depression, anxiety, or their mood is swaying, taking the time to say, hey, I'm recognizing these things in you. Please go see someone and come back with a note that lets us know how we can best support you as you're going through this trying time emotionally. We have benefits for physical wellness and we have benefits for mental wellness. But for some reason, those are the benefits that always just stay there and aren't utilized. So utilize them. You wouldn't walk around, let an employee or a coworker walk around with a bone sticking out of their arm. Don't let them walk around feeling like a weight is on their shoulders and that they are alone.
It's so crazy, Chardé, that you said that. I have a staff member, and yesterday she came to work, and my spirit was just so strong when she walked through the door, and I'm like, is you okay? I'm like, something wrong. I said, you didn't do your hair today. I said, you come in here, your clothes just don't look like you. And I'm like, and I noticed you increased your eating. And I pay
Mhm.
attention to people that I'm around. So I've been watching her for probably a month now. And
Mm.
but yesterday it just hit different. Girl, don't you know she just bust out crying. And all I
Mm.
could do was just hug her for a while. She said, "All I just need a hug." She was like, "Thank you. I really just need a hug." And she vented to me and um just basically expressing herself of things that she's been going through. And I literally had to reach out to some people and
Mm.
they came right away to come talk to her. And I feel like it's so important for you to actually pay attention to your staff. A lot of times they don't react to things for no reason. They
Yeah.
don't do certain things for no reason. Some may, however, most of the time you got to understand that they have a life outside of that job. When they
Yes.
walk through that door, it may be difficult for them to just leave it out the door and not bring it in the door because it may be something weighing on them so heavy, but it's not healthy to let them just crash out like that. You really
Yeah.
got to take into consideration because to be honest, people are committing suicide
Yeah.
at the blink of an eye, and it could be something on the job site. You just never know. So just communicating with staff, and I appreciate you for even just putting that out there and making it an awareness for people to know, because I feel like it's so important. And yesterday it just really hit different for me to really see that. And I literally thank God for just even giving me the discernment that I have to even notice that within her, because it probably could have been worse if I would have just let it go.
Yeah. And I tell people suicide prevention is everyone's business. And just simply saying something, asking, literally saves lives. And so kudos to you for acknowledging that and speaking, because so many times we see things and we don't say anything because we feel
Yeah.
uncomfortable, because
Yeah.
it's like I don't want to, be in a business, or maybe I'm overthinking. And so we hold back because we don't want to have uncomfortable moments with someone, even though we may see them declining. And I
Yeah.
tell people, I'd rather have an uncomfortable moment with you while you're alive than feel terrible at your funeral.
Oh God, yeah.
So
Yeah.
speak, say something. If you end up putting your foot in your mouth, then apologize and be like, all right, well, I'm happy you're doing good. But a lot of times, just saying something allows for them to be free enough to let it out. Because that's exactly what happened with your
Yeah.
staff person. Because you said something, she finally felt free enough to release and now receive the help and the support that she deserves.
Yeah. Yeah, because it was a lot. It was weighing on me so heavy, girl. If you would have felt the energy if you was
Mm,
there.
mm.
With you being such an expert at what you do, you would have been like, "Is something going on?" I already know you
Yes,
would.
yes, and I tell people, because sometimes, you can feel it and they're not as forthcoming, right? And it's just like,
Mhm.
okay, so you just like you do your part, but you don't want to keep prying because they're denying. And I tell people you can always follow up with a resource. And I'm like, all right, well, life is hard out here sometimes. So if you ever do feel like you need to talk to someone, dial 988. They're 24/7. There's people there who you can talk to. You can text or dial them at any time. It's a national hotline with experts on there that have a job to save your life. Like
Yeah.
you better use them. And that's what I like to tell people when we start talking about feeling. Sometimes we feel like we are a burden if we seek help. And I'm like,
Mhm.
you realize that there are people who went into debt to get a degree to do a job to save your life. That's how
Mhm.
important you are. That
Yeah.
somebody, millions of people, have gone into debt to study for 4+ years and to get paid and get a work that is to save your life. You better utilize that resource. You are not a burden. You are why they exist. Your existence is why, as a social worker and a clinician, I exist. Because of you and the struggles that humans go through, I have decided to be in this field. So when you don't seek help, I'm like, man, are we not needed anymore? What's going on?
Yeah.
No. So there is strength in asking for help. There is strength in asking for help.
Now, asking for help can be difficult. And sometimes it's hard for people to have this conversation, but a lot of people, I ain't gonna say a lot, some people actually seek help and don't receive help. What How can you support them and give them the confidence to not give up when one individual didn't give them what they wanted and that they needed? How can they just keep going and not give up the situation? Because you are you are advocacy and you a champion of social workers. So, and sometimes social workers get a bad rep when it comes to different things of helping families, and sometimes tragedies happen and sometimes other things happen and it's left unsaid. How can people feel a lot more comfortable in that space?
Yeah. The first thing is, advocating for yourself and communicating. And so when we're advocating and communicating for ourselves, it's going to take more than one time. It's going to take more than two times.
It is.
And so it's just knowing that you are worth it to not give up. You are worth it to not give up. And I would encourage people. I also work with the organization Legacies Empowered, where they actually support people in linking them to resources and walking them through that process. So, because you're right, a lot of people get stuck in the cycle, get stuck. And you call, somebody says they're going to call you back, but they don't, and all of this. And it is very frustrating, extremely. And so I would encourage people to reach out to Legacies Empowered so that they can support you in getting connected to a mental health provider, whether it's for groups or whether it's for individual, whether it's for you or someone you care for, because it can be frustrating. And there's no quick or 100% right answer, because the truth is it's going to happen. But part of the role that we have as advocates is to also know about resources that can help just a little bit with that ongoing cycle of not getting anywhere. And for women who are looking for healthcare providers that will let you feel seen and heard, I recommend Village of Healing. And for those who feel like they're just in the loop and cycle of getting the mental health support that they need, I recommend Legacies Empowered. These are the types of organizations that are small but mighty, and have lived experiences that give them the passion to make sure that you live to see tomorrow and get the help and the support that you deserve.
Yes. So there's often a deep connection between mental health and advocacy. What do you believe that needs to shift in policy or practice to support mental wellness on a systematic level?
Definitely when we talk about funding, by advocating for mental health funding, and supporting policies that expand access to care and challenging the stigma around what it's looking like to seek help. It's important to recognize and appreciate what mental health professionals are doing for communities, because it's all tied together. So you want to make sure that you're talking to your local politicians and that you voted in to say, hey, I want to make sure that there's mental health that's accessible for our community, from your school board to your council people to your mayors, governors, and beyond. You definitely want to make sure that you're having conversations about mental health and how you want to make sure that it's accessible to you and your family and your community. Writing those letters, showing up to those meetings, posting different things and using hashtags for those who are social media savvy. All of those things put things out there so that people can know and see like, oh, this is important to people. Let's make sure that we're funding it, that we're supporting it, and that we're providing them with the resources they need to keep on going.
Yes. For our listeners, how can everyday people support, uplift the work of social workers are doing, and especially in the underserved areas?
Show up to those meetings, and making sure that your school board member, your council people, they are hearing what you're saying, and that you're advocating for yourself and your community. Volunteer.
Oh, yeah.
Volunteer. And you
Yes.
don't have to be everywhere all the time, but find an organization that aligns with your beliefs and your passion and stick with them. And I encourage you to find an organization that is small, not the
Mhm.
organizations that are larger, that
Yeah.
can fund and pay for employees and have, national presence, but those who are right in your own backyard, who are doing impactful work with just 2 and 3 people. Volunteer and support. Be on boards for nonprofit organizations. Donate. And when I say donate, it doesn't have to be thousands of dollars. You can literally donate $20, a month, or $5 a month. Just showing that consistency lets people know that the meaningful work that they're doing is important and necessary. So
Mhm.
I definitely want to make sure that people know that their voice matters in this space, and your presence matters. Show up to the events that people are having that promote mental health and wellness. Show up to events and conversations when these matters are on the table to be discussed on if there will be funding available or access. You want to show up, you want to be present, and you want to utilize your voice.
Wow. So, how can people get in touch with Relevant Connections, and if they are seeking resources, services, or even partnership?
Yes, so they can visit relevantconnections.org or follow us on social media. So whether it's LinkedIn, Facebook, or Instagram, you can find us there. And we would love to give you the support that you need. Like I said, the self-care plan, if you heard about that and think that's something that will be beneficial for you, as well as a list of questions and things to look for when you're seeking a therapist or mental health resources. Those are things that you can find on our website and download and have so that you can start your mental health wellness journey.
Wow. So, what's one small but powerful step someone can take today towards better mental wellness?
Give yourself grace. You don't have to do it all at once. Prioritizing your mental wellness, it is an act of self-care
Yeah.
and strength.
Yeah.
Small, consistent steps towards self-care can lead to transformative change. You're not going to wake up with a six-pack. You got to do some work for it, you
Why?
know? Right? And dare I say, some of us, me, will never have a six-pack. But but the actions that I take in order to attempt to receive a six-pack will make my life healthier. So
Hmm.
sometimes in our mind, we have perfection as a goal and we will never get there.
Yeah.
However, if I just keep on working, even though I may never be perfect, I will get better. And
Yeah.
that's what I want to tell people, that you just have to do the small things to make big impact for yourself. You want to set those boundaries. You want to capitalize on your commute in the car. You want to do your deep breathing and you want to give yourself grace. That is an act of self-care,
Yeah.
giving yourself grace.
Definitely. Well, thank you so much, Chardé. I really appreciate you and all the knowledge that you share. It was really amazing.
Thank you again for having me. I really appreciate it and enjoyed the conversation. And I want everybody to remember that mental health is physical health. So go ahead, get you a therapist.
You ain't lying. Well, thank you everyone for tuning in to Life Heard Podcast. Make sure you subscribe and also listen to Life Heard Podcast on all major platforms, audio. Thank you.
Welcome to Life Her Podcast, the podcast that guides you from the 9-to-5 grind to the freedom of your own path. Discover how to conquer life's challenges while pursuing your passions with unwavering faith. Because being an entrepreneur is not easy. So let's get to it.